Hello everyone. I am Dr. Roja LD, completed BMS MD in Ayurveda. From today onwards, I am started to record research classes for the final year BMS students. The motto of recording these classes is to make students understand research topic in a simplified way. It is strictly made on the basis of new NCISM syllabus. You can access my classes anytime, anywhere, and it is free of cost to all the BAMS students all over the India. We shall start the today's class now. So the first chapter deals with introduction to research, objectives, need and scope of the research, concept of evidence-based medicine and integrative medicine. See, you may come across the terminologies like CC. CC is nothing but cognitive or comprehension. You are understanding the things, whatever I'm going to tell. You're not analyzing, you're just understanding the things, whatever I'm going to tell. That is known as cognitive or comprehension. MK, which is nothing but must to know topics. See, as you are a student of RS7 batch, you very familiar with the terminologies of MK. So all the students must have a mm, definite knowledge on this particular topic if it is mentioned as must to know. So each student must to know, must have particular knowledge regarding the particular topic if it is labeled as MK. And L and PPT is nothing but lecture with PPT presentation. TOBT is nothing but theory open book test. If we give you a book, you will open it and you will search some of the information related to the particular topic and you will note it down. That is known as theory open book test. And you may come across the quizzes from this particular topic and puzzles. You can solve the puzzles from this particular topic. It is a summative and it starts from your second internals. Okay, see, whenever you join this final year BMS, very early, you will not have this particular subject. After 6 months of your final year batch, so you will start to have this particular subject into your curriculum. I hope you understood. Now we will discuss one by one. See, as per the terminology, re is nothing but again, anew, or over again. Okay. Search, which means that examine closely and carefully. You are searching something which is already present. It's already present on the world. We are searching very closely and carefully to test and to try. Okay. That is the meaning of the word. And the definition of the word comes like this. Research is the systematic, creative investigation designed to develop or contribute to generalizable knowledge, involving what it involves is involving the organized collection, analysis, interpretation of data to answer questions or solve problems. Okay. See, here you are conducting a research. Any research you take, systematically you are doing investigation. Why you are doing an investigation? To answer the question. Any research work you have, the purpose of research work you will have, either aim of the research work or objective of the research work. You need to answer the question. To answer the question, you are systematically doing investigations and you collect the data, you collect it in proper way, involved organized collection, you analyze the data and interpret the data why, which is to answer the question or to solve the problem what you previously already had. Okay, this is the meaning of definition of the research. I hope you understood the topic. A research objective is defined as a clear and concise statement of the specific goals and aims of a research study. In simplified manner, if you want to understand objectives of research, what is the aim of your work? Why you are doing your work? Okay. So that is the objective of research work. Why you are doing your work? For some purpose you are doing that research work. That is known as objective of research. Now, this research methodology is included in our BMS syllabus. So, what are all the objectives of research are present in Ayurveda that we definitely have to study in detail? First one is discover new truth. See, some truth are already present. It is you need to discover. Okay, you need to uncover it. Okay, research seeks to find and uncover the truth that are hidden, okay, or have not yet been discovered. For that, we need research and solve the problems. A primary goal is to find solution to unsolved problems. So through systematic methods. For example, just COVID-19 came previously, it was not there. What best treatment is there in Ayurveda? So the problem is COVID-19. You need to solve the problem by doing the research work. That is the objective. It is not only the COVID, any CA, stage 4 CA or HIV, or such diseases which doesn't have a particular treatment. Can you contribute are signs in such particular diseases? So all these problems are already present in the public. How you can contribute to these problems? And one more thing, westernization has been going on all over the Indian population, right? So for which most of the diseases has been arising out of these westernization, like obesity, early diabetes mellitus. So how to solve these problems using our Ayurveda? All these are the objectives of research. Next is evidence-based validation. See, Ayurveda is a particular science which is not in the language of the current scientific language. So, in order to make them understand, we need to simplify our Ayurveda in the current scientific knowledge, language. So, to provide scientific data on the efficacy and safety of Ayurveda products and practices, we need this evidence-based support. And to evaluate effectiveness of specific formulation and treatment for various conditions to improve therapeutic outcome, we need research and standardize quality. See, to generate any medicine, either modern or Ayurveda, safety comes first. Preclinical studies we all do, standardization we do, and quality control of parameters we do adapt for all the Ayurveda products in order to provide standardized uniform formulations to the public, to the patients, right? So that's why we need standardization is very essential, for which we need research. And safety and quality control, which is particularly for pharmaceutical Ayurveda products, to create data and safety, standardization, and quality control for Ayurveda products and practices to meet modern regulatory requirements. See, sometimes someone claim that Ayurveda is pseudoscience, whatever medicine they are giving, and some other people will claim that our medicine is the one which contains heavy metals like that. See, if we have a data on the safety, standardization, quality control for every particular Ayurveda products, we definitely could answer these questions which comes through our life. Standardized formulation is we have to see we are preparing medicines as per the classics mentioned by our acharyas, right? So, but if we want to standardize formulations, if we want to prepare the same Arogya Vardhini Vati uniformly throughout India, so we should have some standardization. Even to develop standardized protocols, we need research work. Then modern relevance and integration. See, address modern health problems, just I have explained to solve the problems, to upgrade Ayurvedic knowledge and practice in response to new diseases and health related issues. Suppose many of them are suffering from obesity, type 2 diabetes mellitus, when it comes to females, PCOD, and thyroid disorders, either hypo or hyperthyroidism. See, 20 years ago, nobody were hearing thyroid disorders or PCOD, but it is just from last 2 decades, most of the female patients who take PCOD, thyroid disorders, they're all considered to be a generalized disease. If you just consider they as a disease, there is very less healthy people are available in India. So that's why what Ayurveda knowledge helps and our practice helps in response to new diseases which are becoming epidemic nowadays. So these modern health problems has to be addressed and integrate with modern science. So it is not Ayurveda, it is not modern, it is not homeopathy like that. What we together best we can contribute to the society? That is an important question. So that's why to explore the potential of Ayurveda in integrative healthcare system by conducting studies that compare its effectiveness, safety, and cost effectiveness with conventional approaches, which is very important. And explore preventive healthcare. See, we have two mottos, two mission of Ayurveda. One is Swasthasya Swasthya Rakshanam, another one is Adhoresya Vikara Prashamanam Cha. So preventive healthcare is very, very important in Ayurveda. So what Dinacharya public can follow, what Ritacharya public can follow. To research the role of Ayurvedic principles like diet and lifestyle modifications in promoting longevity and immunity for everything, we definitely have to do research work. This is the modern relevance and integration. So this is regarding the objectives of the research work. If you can't explain it in detail, at least modern relevance and integration you need to write. In front of that one, address modern health problems and integrate with modern science, explore preventive healthcare. Like that, these points can be mentioned in your exams. But one thing is, whenever, whatever you go to study, you should have a particular knowledge on that. It is not that just you are by hearting a topic and you are copying it in your exam, so it is definitely useless. So research methodologies, the principles of research, objectives of research, everything should be known to us. That's why the syllabus has been kept in your final year student. So better to understand the topic and learn it. Uh, because I have explained it in detail, I hope it is very helpful for you to learn. So the next is need of research. Why do we need research work? See, we are many doctors. We are following our acharyas. Okay, many patients are coming. We are treating the patients and we are happy, right? So why do we need this research work? One thing is evidence-based validations. I told you last time, many patients, most of the people call very professionals, healthy professional itself. Healthcare professionals are telling that Ayurveda is a pseudoscience. So, which is can't be accepted by a Ministry of Ayush, NCISM, or any of us, right? So, even to validate our Ayurveda as a science in front of the whole society, we should have evidence-based validation, right? So that's why to scientifically validate the efficacy and safety of Ayurvedic treatments and products. So bridging the gap between the traditional knowledge and modern scientific understanding, it is the need of the research. Yeah, it that's what we definitely need. That's why research is needed, because if we have a data that we have treated patients of Amavata using Simanada Gugulu, we definitely can show to the public that we have treated these many patients and patient got rid of the diseases and our medicine is considered to be safe, and patient is happy with our treatment, and patient has no untoward effects from our Ayurveda medicines. Like that, we can answer if we have evidence-based validation. Okay. And next thing is quality control. Yeah, need of researchers. As per our acharyas, we are preparing medicines, but it's not that so. Yeah, as per acharyas, we need to prepare medicines. What standardized parameters you have taken as per the modern science? Suppose you use a water, heavy metals like lead are present in that. In case of soil and mercury is present in that. Those heavy metals should not be present even in our Ayurveda drugs. So there are some certain parameters which are present, which has to be made by all our Ayurveda products. So that's why quality control parameters and standardized pharmaceutical procedures has to be established in order to provide safe, effective medicines to our patient. That's why quality control is a need of research in Ayurveda. Next, revival and modernization, just like objectives, it is repeated here. To review and update classical literature while also developing new treatments to address contemporary health challenges and diseases. So, as I explained before, integration and preservation. So, we need to preserve our Ayurveda, because already if we just go to Kashyapa Samhita, most of the chapters are must, right? If we don't preserve, being an Ayurveda practitioners, if we won't preserve our vast knowledge of Ayurveda, it will be useless for the next generations to treat their diseases. That's why preservation is a need of the research, to preserve the vast knowledge of Ayurveda by documenting and understanding it through modern scientific methods, ensuring its transmission to future generation. Next is scope of research in Ayurveda. Fundamental research. To study and scientifically validate foundational concepts like the dosha, dhatu, and mala theories. See, if we go to any unknown Ayurveda person, I will tell if this dosha is aggravated in you, this dhatu is emaciated in you. You will not understand, right? So, the fundamental principle of Ayurveda is on Tridosha, Sapta Dhatu, and Manas. How you can explain this to normal public? So scientifically, how you can validate these terminologies, that comes under the fundamental research. It is the scope of research in Ayurveda. And literary research, to review and analyze classical text and manuscripts to ensure accurate and relevant understanding of ancient knowledge. Okay, so that is a literary work. Suppose you take a particular topic like Amavata, what is stored by Charaka, what is stored by Shushruta, what is stored by Vagbata. Just simple example I have given. Jwara you take. What is stored by Bruhatrayis? What is the best treatment among three of them? So like you can analyze, you can implement it in clinically. Clinical research is to conduct clinical trials to assess the effectiveness of treatment for various conditions ranging from chronic diseases to preventive and promotive health. Okay, many clinical trials has to be conducted to assess effectiveness of a treatment, including panchakarma, from chronic diseases to promote preventive and promotive health. Suppose in clinical research, as per the seasons, healthy individual is the one who is going through panchakarma. As he faced any problems according to his age or his longevity has been extended, so you assess all such conditions in a healthy individual, and that is also a contribution to the public that if you follow the panchakarma procedures as per the seasons, your longevity will be enhanced. Like that, we can comment on that. That is the scope of research in clinical research. Drug research, as I told you, to develop new formulations. See, we don't have a facial cream, we don't have moisturizers, right? We don't have foundation powder. So, what new formulations we can develop, and what syrups, what capsules we can give it to patients if some of our medicines are unpalatable. So, new formulations, how you do and identify novel drug combinations to standardize both raw and finished products. Then pharmacological and phytochemical researches. What see we know Tulsi is the one which acts works good on Jwara and Kaza. But what active compound, what chemical compound present in this Tulsi responsible to decrease the fever and cough? So that is also a study. So to analyze the active compound in Ayurvedic herbs and formulation and to conduct studies on their mechanism of action, how it act on our body as per the modern mechanism like pharmacodynamics. Interdisciplinary and collaborative researches to work with other disciplines like biomedicine and pharmacology to create a more holistic and comprehensive approach to health. All these, I hope you understood, all these are the scope of research in Ayurveda. See, if my class has found useful to all the students, you please share my class to some other BMS students who have not known me and subscribe my channel. Do follow my channel. In the next week, I will upload another next class, historical background of research in Ayurveda and modern science. I will start to record research classes weekly so that you can engage in my classes and take the benefit of it. And don't forget to subscribe and share my channel to all the BMS students. Thank you, Ananda.